Our mission as XDX is to improve patient care by translating the complex signal of the immune system into a very simple, straightforward information that physicians can use to treat patients. In order to do that, you really have first to collect samples of patients when they are well and samples when patients are not well. And then through a massive screening system, you compare the samples and try to identify the signals corresponding to not well and signals corresponding to being well, and from there you extract through a complex mathematical algorithm the real signal that you want to measure, and then you translate that into one single score that the physician can use. The folks here at XDX really come from two very different backgrounds. You have on one hand people that come from the molecular biology side, so they're really people that understand immunology, that can understand the development of the test itself, and then you have a whole group of people, about half of us, who come from the data side, that are biostatisticians, informaticians, algorithm developers, that can sift through thousands of data points and make sense out of it, and then create, in the end, the one signal, the one score that physicians can use, and that is simple enough to aggregate all this complex information.
Each year, approximately 4,500 people receive a heart transplant. In fact, there are 40,000 people worldwide living with transplanted hearts. And while these transplants offer a new lease on life, there are still constant health challenges the patient and physician must face.
Rejection is a process where in a patient, a person who receives a tissue and organ of another person, the immune system is activated. The immune system cells, the white blood cells, then destroy the transplanted organ of the other person. The white blood cells of the person receiving the organ of another person infiltrate the transplanted organ. After infiltration, they start basically eating up the organ. They destroy the cells and the transplanted organ stops functioning. The rejection process must be treated by drugs. These drugs are called immunosuppressive drugs. In fact, only after these drugs were discovered over the last 50 years, organ transplantation has become clinical reality. The most important side effects is that they suppress the immune system's activity and make the patient more susceptible to infection. They also have side effects on every single organ of the body.
Traditionally, to help monitor the signs of rejection, doctors have used the endomyocardial biopsy, an uncomfortable, risky, and costly procedure for the patient.
I introduce a so-called sheath, which is a plastic catheter, into the neck vein. Next, I will have to advance the so-called bioptome, which is an inflexible catheter with scissors at its tip, through this sheath into the heart. The next step will be to take 4 to 6 little pieces under guidance with a fluoroscope from the heart muscle. The side effects and the complications are you can make a hole into the heart and the muscle needs to be repaired. You can tear apart heart valves. You can create a hole in the lung. You can create a hole in the vessel. You can create irregular heartbeats. Having said that, it is also painful and causes discomfort for the patient.
Now, new technology is being used in many of the leading heart transplant facilities in the country. XDX, a molecular diagnostics company based in Brisbane, California, introduced AlloMap molecular expression testing. This innovative test requires only a blood sample to rule out acute cellular rejection.
The whole complexity is actually taken at XDX. From the blood sample, we actually measure 20 genes that are expressed and up or down regulated. Once we have analyzed all of that, we reduce it to one single score from 0 to 40 and report that back to the physician. So the cardiologist can say then, with a low score, they can be very confident in sending the patient home and say that patient will not reject. That's what we do.
This groundbreaking technology can also be used for other solid organ transplants, as well as monitoring of the immune system. Next on the horizon, developing a test for patients with lupus.
In the case of lupus, it's not rejection, but it's the same immunological process whereby the immune system all of a sudden becomes hyperactivated and begins to do some organ damage. We will have the same type of measurements, providing the rheumatologist with an early warning so that they can intervene and help these patients.
I had my heart transplant surgery July of '06, and I had my first biopsy the week after. The biopsy is so much more invasive and painful. They poke you in the neck, and you do have a recovery time because of the bleeding. The AlloMap is so easy because it's just an ordinary blood test. I would definitely recommend the AlloMap testing over the biopsy because it's so easy. You don't even have to think about the whole thing. There is nothing invasive. It's an easy thing. You just sit down in the chair and let them take blood. That's it.
With this breakthrough in heart transplant patient management, XDX is proving that monitoring rejection doesn't have to be a painful process.
Biopsy answers the question either there is rejection or there's no rejection. The new blood test, in conjunction with heart function assessment by heart ultrasound and the clinical examination, tells us that there is nothing explosive going on if the value is below threshold. It is basically a radar for explosions. If we don't see any explosions, we know now with this non-invasive test that there aren't any. It is a blueprint of how to develop diagnostic tests for any kind of medical condition if you can define that medical condition well by expert consensus. It exploits the Human Genome Project's potential in a way that has not been seen before the Genome Project was completed. When the patient comes in, feels clinically well, the heart works fine on heart ultrasound, which is a non-invasive tool, and the new test shows a below threshold value, and we do not need the protocol biopsy. Patients have reported that they like this approach very much.
You know you need the biopsy at one time or another, again, but with the AlloMap, actually they tell more from it because the blood test tells you whatever is going on inside the body.
We call our system a healthcare system. It's a misnomer. It truly is a sick care system. We hope to make it a healthcare system where you basically provide early information to the physician and they can really treat patients much earlier at the lower cost and basically keep them healthy. So there are three things we're doing. One is continuing in transplantation from heart to lung and then kidney and then other solid organ. That's one development that we're doing. A second one is going into autoimmune diseases. We started with lupus. We're going to go into rheumatoid arthritis, multiple sclerosis, and a number of other autoimmune conditions. And the third thing is also for autoimmunity, working with pharmaceutical companies in enabling them to identify the patients that will be the best responders to the therapies that they are developing, meaning that we can help them actually identify the patients that will be the most, that will benefit the most from the treatment that they are developing. As you know, not all patients respond equally to a new treatment, and having the ability to actually tell in advance these patients will benefit or these patients will not, will actually enable the physicians to be more effective and also lower the overall cost to the healthcare system. This simplification process of translating a complex situation, immunology, the immune system, into something that they can use and really make a very big difference for each patient, that's really what we do at XDX.